Here comes the commonly asked question. Can I get pregnant with fibroid? So now you're wondering, what even causes this fibroid? Imagine bleeding heavily every month, that you have to change your pad every hour, and you're even passing large clots, or your stomach is getting bigger and you are not even pregnant. A lot of women might be going through this. Some may or may not know what the cause is, but it could actually be fibroid. Hi guys, welcome back to this channel. I am Dr. Asia, and as usual, I'll be breaking down common health issues. So today's topic is fibroid. It's going to be a little bit long, but just wait till the end. Fibroid is a very large topic, but I'm going to try to make it as short as possible. All right, let's begin. In today's video, I'm going to be explaining everything you need to know about fibroid, the symptoms that it presents with, and the possible treatment options. So if you've ever worried that you have fibroids or you know someone that has fibroid, then stay to the end of this video and share it to them. What are fibroids? Fibroids are non-cancerous growths in the uterus. Uterus means the womb. So when next I mention uterus, you know I'm talking about the womb. These growths are made up of muscles and tissues. The tissues are the same tissues that line the wall of your uterus. And fibroid can be as small as a seed or it can be as large as watermelon. Now, a lot of women have fibroids, but it might just not be symptomatic. As long as you have a womb, you're at risk of having fibroid because fibroid happens in your fertile years, meaning your reproductive years. The important thing to know here is that a lot of women actually have fibroid. It just depends on the size and if it's symptomatic. The location of the fibroid also matters. The fibroid can be on the walls of the uterus. It can also be on the outer surface of the uterus or within the uterine cavity. So what are the symptoms that someone with fibroid might have? The major one is heavy bleeding during your period. I don't mean just heavy bleeding on the first day or the second day. I mean, if you menstruate for 5 days, you have heavy bleeding for those 5 days, that it involves passing large clots, the kind of bleeding that you have to use like 8 to 10 pads a day. Then there can also be severe pain around the pelvic region, depending on the size of the fibroid. The fibroid can press on nearby organs, and you might experience frequent urination, even constipation. Some people describe it as feeling a pressure around their abdomen. Fibroid can also increase the risk of having miscarriages. You might also experience pain during sex or lower back pain. The funny thing is, some women actually have fibroids and do not have any of these symptoms at all, and they just live their lives normally. Some might just notice that their stomach is just getting big and they are wondering what's causing that. So now you're wondering what even causes this fibroid. The truth is, there is no exact cause per se, but there are some major things that play a role in developing fibroid, which I'll be breaking down for you. Things that can put you at risk of developing fibroid: obesity, if there's been a family history of that. And basically, anyone with a womb can actually develop fibroid. One thing is that fibroid is actually more common in black women than white women. There are two hormones that play a vital role in this fibroid development. The hormones are estrogen and progesterone. Estrogen is needed in a woman to help with the thickening of the uterine wall to prepare for pregnancy after ovulation. And when there is no fertilization, that wall sheds, and that's what we see as period, right? But this same estrogen hormone is needed by the fibroid. So it's basically like the fibroid feeds on this hormone to grow. But you also need this hormone to prepare your womb for pregnancy, isn't it? Now, the second one, which is the progesterone, there's a material in the body called a matrix. That's how best I can explain it. A matrix, right? And this matrix helps cells to form together. So this progesterone helps with the development of this matrix. And that's the reason why when the fibroid starts to form, it gets bigger and then it sticks together. Here comes the commonly asked question: can I get pregnant with fibroid? The answer is yes, you can actually get pregnant with fibroid. Some women with fibroids get pregnant and have a completely normal pregnancy, no issues. Whereas some would actually get pregnant and have issues like continuous miscarriage, finding it difficult to conceive. But the challenge here is the location of the fibroid is very important, and the size of the fibroid. Those are the two things that will determine if this person is fit to carry a pregnancy. So having fibroid does not necessarily mean that you are infertile, right? If the fibroid is actually located in the innermost layer of the uterus, that can actually increase the risk of miscarriage. And this is why you need to work hand in hand with your gynecologist. Like I said earlier, fibroid feeds on the hormone estrogen. And in pregnancy, that hormone is also needed. So as the pregnancy is growing, the fibroid too would also grow in size. That means like both the fibroid and the baby are competing for space in the womb, isn't it? So there are some things that fibroid can actually lead to in pregnancy. One of them is called placental abruption. This is when the placenta separates from the womb, and then the oxygen and nutrients that is needed to be passed through the placenta does not get to the baby. And that might result in maybe emergency CS. Another complication is having a cesarean section rather than vaginal delivery. Maybe because the space for the baby to actually be delivered is too tight or too small. Another one is premature labor or preterm delivery. There is something I'm about to talk about now. I would like you to pay attention to it. It's called red degeneration of fibroid in pregnancy. I know the grammar might look too big. I'll break it down. This red degeneration happens in pregnancy. So it is when the fibroid begins to grow so fast in the womb, and all of a sudden the blood supply to the fibroid is cut off. Because like I said earlier, the fibroid and the baby would be competing for space and a lot of things. So the blood supply to the fibroid is cut off because it's growing so rapidly and it's requiring a lot, and the baby also requires a lot. When this happens, the fibroid starts to break down from inside and it bleeds. So this blood is now trapped within the uterus. This trapped blood causes severe pain. Although this lasts for just few hours to few days, and it can be managed temporarily with pain relievers. And after that, that's fine. Pregnancy continues. But if not found in time, it can actually be dangerous, like putting the baby at risk. Now, let's talk about treatment because I know that's what a lot of you are waiting to hear. Treatment actually depends on the size and the location of the fibroid and if you actually want to bear children. One thing I'm going to let you know is be sure that that fibroid is actually the reason why you have trying to conceive. What I mean by that is if you've run other fertility investigations like HSG, you see that your tubes are open and none of it is blocked, or you've checked that your husband's semen analysis is perfect, your hormones are perfect, and you don't have PCOS or any other thing that can hinder fertility. Yeah, sure that all those things are fine, but the fibroid is actually what's causing you not to have children. That is also what will determine your treatment. Number one, there are some medications that can be used, also known as contraceptives or birth control pills. They are mainly used to help with heavy bleeding, actually. And because these are hormonal drugs, there is a slight chance that the fibroid might grow just a tiny bit bigger. But these drugs would actually help to control the heavy bleeding and make it minimal. But remember, it's also a contraceptive. So you won't be able to get pregnant while on them. If the fibroid is not causing you any symptom at all, you can just leave it. That's it. Like I said, it depends on the size, the location, and if you still want to bear children. There is also what we call the progesterone releasing intrauterine device. It's not the normal IUCD copper T, you know. This is also used to help regulate the heavy bleeding. There is another medication called GnRH agonist. These medications are actually used to help shrink the fibroid. It's mostly used prior to the surgery. For example, if a person is scheduled for a myomectomy, they give the medication few weeks or a month to the procedure to help shrink the fibroid a little. But sometimes some gynecologists might decide to prescribe that for their patients. But the side effect of this is that you start experiencing menopausal symptoms like the hot flushes, vaginal dryness, and all that. Another one is a medication called tranexamic acid. It's also used to manage heavy bleeding. So let's move on to the surgical part. The surgery for the removal of fibroid is known as myomectomy. There are various surgeries to help remove fibroid. Myomectomy can be done with a laparoscope, a hysteroscope, or open myomectomy. Laparoscopic myomectomy is when they use a tube with a camera and they make tiny hole incisions around your abdomen and the tube is passed to remove the fibroid from it. The hysteroscopic myomectomy is the one that's done through the vagina and through the cervix to the uterus. It also uses a tube with a camera to remove it. Then the open myomectomy is the one where an incision is made, meaning a cut into the skin is made either at the lower abdomen or the middle of the abdomen to remove the fibroid. Another treatment option is hysterectomy, which means the removal of the womb entirely. Remember, I said as long as you have a womb, you're at risk. So if you know you're done bearing children or do not want to have children, that is the best management for you to remove the womb entirely. That doesn't mean that your ovaries are also going to be removed. No, your ovaries will still be there. So you might want to just try IVF or surrogacy in the future with your own eggs. It depends. There is another procedure called uterine artery embolization. This one requires both a radiologist and a gynecologist to do the procedure because the radiologist is going to use because a catheter is going to be passed by the radiologist into the artery that actually feeds the fibroid with blood. Once the catheter gets to the artery, a small particle will be passed through that catheter to block the pathway for blood to get to the fibroid. So the fibroid dies. Remember what I said about red degeneration, that when it grows rapidly and the blood supply is cut off, it begins to die from inside and it bleeds. So it's a similar case, but this one, they are initiating the cut of the blood supply. There is also another one called radiofrequency treatment. Is when they use high heat waves to actually try to shrink the fibroid using a laparoscope. That's that tube that pass through small hole incisions in the abdomen. But remember, the uterine artery embolization, the radio frequency, it's not suitable for everyone actually. So it all depends on the case per individual. And your gynecologist will be the best to decide if that is actually what suits you as your management. Here comes my candid advice. I've not really been in the practice for as long as a consultant would, but I've been in the practice for about 3 years now. And what I've seen over the years is what's making me to give this advice. If you're actually sure that the fibroid is the reason why you have still not conceived, and you are certain that that's the reason, you've done every investigation, your gynecologist, you both have sat down and cracked the codes and discovered, yeah, it has to be removed. If you're not ready to bear children, right, do not go ahead for a myomectomy. For example, maybe you are 20, in your 20s and you're not ready to have kids, but this fibroid is killing you, dealing with you. Try to just be on the medications that can help to reduce the heavy bleeding you experience every month. I know it's not easy, it's easier said than done, but that's my advice. Because why? After a myomectomy, yes, the fibroid will be removed. But remember, I said you are at risk as long as you have a womb. Fresh fibroids can still grow back because it still feeds on the estrogen that the womb needs. So that's what I'm saying. If you are not ready to bear children, don't go for it. But when you are ready to bear children, you can go for it. And then within 6 months, when you are fully recovered, you can now start trying to conceive before a fresh fibroid grows. And you can also sit down and make your research after learning your diagnosis before opting for certain treatments. Yes, we doctors will give you the best choices, but it's still in your hands to choose which one you want to go for. Don't just blindly accept whatever management is presented to you. Let's quickly clear some myths. Fibroids are not caused by witchcraft or punishment for something you did wrong in the past. I don't want you to have that kind of mindset that, oh, is it because I did this? Is it because I had an abortion or a miscarriage and that's why I'm having this fibroid? No, no, no. Fibroids are not cancerous growths. They are growths made up of muscles and tissues. So it is not cancerous, okay? Not all fibroids need to be removed. Also, fibroid doesn't just affect older women. Young women can also have fibroid. And last but not the least, there is no herbal concussion you want to use in this world that will dissolve the fibroid. Let me tell you the truth. Yes, I believe in some herbal practices. Yes, some of them work. I mean, some of the medications being produced now are actually extracted from some herbal components. But there is no herbal mixture that you go to one lab, they'll tell you chemical. It is not going to magically dissolve or shrink the fibroid because the hormone that the fibroid needs, every woman needs it. So don't be deceived. The most important thing is early evaluation and medical knowledge. And like I said earlier, fibroid is a very large topic, and I hope I've been able to explain it enough well for you to understand. So if you enjoyed this video, don't forget to subscribe, like, and share to all the women in your life. Thank you. See you in the next one.